Welcome and thanks for joining us. We're just outside beautiful Cleveland, Ohio, at the Canterbury Golf Club for the first ever live with an audience as they continue to drift over. The first live episode of Megaphone from Medvale Media. I'm Dave Self, and I'm so happy today to be joined by fellow Medvalista and friend Pam Holt, CEO of Empathetics. Pam, welcome.
Hi, thanks for having me. Great to see you.
Yeah, it's a privilege. Thanks for making time. Would you give us a little background on your journey, how you got to where you are with Empathetics, and don't leave out the good stuff from the past?
Yeah, sure. I'm from Southwest Missouri originally, born and raised. I was actually born at the same hospital where I went to nursing school and where I worked as a nurse. And left the bedside after a short period of time because I realized that the work culture inside that very fast-paced organization was pretty toxic. And I didn't know that when I was in nursing school. And I didn't want to spend my career there. And I decided when I left the bedside, I needed to make a difference in healthcare. And it wasn't going to be taking care of patients on a daily basis. And that was 30 years ago. So I left the bedside and thought I was going to go to medical school, and was offered an opportunity by the hospital, large 800-bed hospital, to build a startup inside the organization. And I don't know if I was young and naive or if I was really courageous. They offered me my salary and $10,000 and said, "Are you interested?" And I don't know why, but I was so excited. So I took this opportunity and I built what was a large injury prevention center, hospital-based injury prevention center, one of the first hospital-based injury prevention centers in the country. The business problem we were solving was unreimbursable trauma care. And I started in a very interesting place. Trauma centers collect all this data in the trauma registry. So I started at the trauma registry looking at why are people coming into our hospital who don't have insurance, and how do we prevent that? And that started a data-driven injury prevention center that I turned into a profit center. We ended up generating revenue. And from there, the health system was changing strategic direction. Big 40 hospital health system. They were going to build an ACO, and the health system president said, "All that stuff you did for injury and safety, can you do that for people with like diabetes and heart failure?" So I joined that team to build the ACOs, and I was responsible for the patient engagement, patient education pillar, and we had great success. So then, like a lot of people in healthcare, I left healthcare and went to the industry side. I went over to a startup, a patient engagement startup, and helped them to an exit.
And what year was this?
This was in 2015.
Okay.
And so found myself there and realized I love the culture of the startup world. And you could really make an impact fast. And that was great. I could just roll up my sleeves and make a difference. So, and make healthcare better. So I was at the startup, had a great success. They sold the startup to Wolters Kluwer, Up to Date. Stayed there with my head down for a few years. Started another startup with a co-founder that became victim
Serial entrepreneur now.
Serial, I have the bug, right? And ended up, our term sheets got dissolved due to COVID. We had a great concept, but of course, everyone flipped a switch and built what we were going to build overnight, literally. And so I then found myself back at the center of healthcare data. And I was introduced to a couple of people who were really brilliant at data exchange and cybersecurity, and they were looking at building a clinical data exchange platform. And it's a really brilliant platform. I helped them get started. I sat in the unique position that I was the only US employee. They were a Tel Aviv-based company. They still exist and they're having great success. But I left that company and then joined Empathetics. And the reason I joined Empathetics is it gets back to that day that I left the bedside and I said to myself, I have to fix healthcare. I have to fix this toxic environment that exists at the bedside. And that's exactly what Empathetics is doing. We are teaching people how to interact, how to communicate, and how to connect with each other. And that's what's missing amongst our peers and between clinicians and patients in healthcare.
What was the genesis of Empathetics? It existed before you arrived.
It did.
Give us a quick history lesson.
Dr. Helen Reese, in my opinion, deserves a Nobel Prize. She is a researcher in the field of empathy, and she asked one question: can empathy be taught? And the answer that she discovered is yes, it can. Before her research, the world believed you were either born with empathy or without it. I once thought I didn't have empathy. And we can actually learn to be empathetic, and our capacity for empathy grows or shrinks based on the situation that we're in. So she discovered this and did a whole body of research around how do we grow the capacity for empathy. And she wrote a book called The Empathy Effect, published several papers, supported by 2 randomized controlled trials at Mass General. And that she founded Empathetics to do the same thing I wanted to do, and that was improve the environment in which our peers were working and in which patients were being delivered care.
Well, it sounds like you had a strong reason to join Empathetics. What is the goal now for the organization? You've signed on as the CEO. You've got a great legacy with Dr. Reese still involved.
Yes, she's the chief medical officer. She's vital to the organization.
So where are you taking the organization?
Yeah, so Empathetics is 2 things. It's online learning, traditional online learning. So there are 3 core courses that are divided into 20-minute modules. And we're in healthcare, we do e-learning, we do online learning for compliance, but our learning is a bit different in that it's very interactive. I'm a nurse, and when I signed on to Empathetics, they assigned me the program. So guilty as charged, and we've all done this if we're a clinician. You open it and you just try to get to the test so you can take the test at the end, and you're like, I'm going to test out of this. And I'm the incoming CEO to Empathetics, and I'm pushing the button, and I'm like, oh, I have to move the things around. And I found myself less than 2 minutes in, intrigued by what I was learning. And I was like, ooh, I need more of this. I need more of this. And so what we find is all of our online learning, you earn CME and CEU credit when you do it. But I wanted more because of the interaction. And I wanted to be able to go back to it during my day and say, oh, I remember a thing about that. What we teach in the online learning is unique. And I want to talk about the concept of teaching empathy for a minute. We are an empathy training company. But one of the things when I say we teach empathy, I get a blank stare usually. It's sort of like, can you catch a cloud and pin it down? Can you hold a moonbeam in your hand? Like, what is the thing? Empathy. And what we're really teaching is how to read someone's facial expressions, how to understand what they're feeling so we can respond in a meaningful way. That's empathy. If you don't understand where they're coming from, then it's hard for you to respond in the same way. I give the example of if someone's angry and you think they're surprised, it's going to be a bad interaction. And so, and the facial expressions and the way people sit, their posture, you need to be able to read that. And it's as simple as when you walk into a room and you have an interaction with a patient, if they're sitting down, you should sit down. If they're standing up, you should stand up. You should meet them at their level. And when you have 9 minutes in a clinic to interact with someone, it's really hard to remember that. It's really hard to remember to push away from your computer and turn to your patient and connect with them. In Dr. Reese's research, she did skin conductance tracings where if the people were in sync when they were communicating and they had empathy for each other, you could see it in their skin tracing. If one was angry and the other wasn't, it was disconnected. So we want to get people in sync when they're interacting because the communication is better. So that's what the online learning is about. And people want more of it. Clinicians want more of it. We also offer a second part of our product, which is in-person workshops. We'll come in, we'll bring a small group, 15 people. We teach everything from the basics of empathy to self-empathy for clinicians. We teach how to handle difficult interactions and communicating bad news. But just getting people on the same level, nurses and doctors and the security agent who works in the emergency department with the nurses and doctors, to have a conversation and be in sync with each other, and for them to normalize that, oh, it might be bad at work, but we together can make it better. And that's what, at the root, that's what we do at Empathetics.
You said self-empathy. Unpack that for us a little bit.
Yeah. There's a lot of burnout in healthcare. There's a lot of moral injury in healthcare. I'm sure all of our listeners can give an example of a time when they were in healthcare and the workload is so much. And I just think back to COVID. We were asking people to sacrifice, and there's a lot of post-traumatic stress still there, just unspoken heroes, and we aren't talking about it. We have people who never missed a day of work during COVID, and no one has ever mentioned that to them. Wow, that's impressive. We have people who chose not to go to work during COVID because they had loved ones they were caring for and they feel really guilty about it. And instead, we just jumped right over it and we just are back to the paces. And self-empathy is really about taking a minute to say, I care for myself so I can deliver better care for my patients. And what we've done since COVID is we've forgotten that part. We just tried to keep going at that fast pace. You can't care for someone else if you don't care for yourself. So we bring you into a room. We like to start with the leadership team at a hospital or health system, at a clinic or a medical group, and teach the leaders first self-empathy. You need to have self-empathy. We hear stories like, wow, I haven't exercised in 2 years. We hear stories like, I don't spend time with my family because I'm putting my job first. So how do you prioritize? How do you set boundaries? How do you take care of yourself? That's the foundation of Empathetics, and that's what we teach first.
That sounds like square one.
Yeah.
What's step two?
After you remember to take care of yourself and you have a capacity for empathy toward yourself, then you have to learn the foundations of empathy to others. Like I said, reading those facial expressions, reading body cues, the basics of interaction. One of the unique things that happens in the world today is half the population has only ever interacted with a mobile device in their hand. And if you ask them to solve a life problem, they're looking at their phone. We've developed this posture where we're here and we forget to look up and see, oh, we're failing as humankind to know how to interact with each other. Have you ever had someone, I'll text you because it's easier?
Sitting right here.
Exactly. Yes. It happens. And so we are trying to teach people, when you go to work, when you're in society and you're interacting, how do you interact? And your tone of your voice, your inflection, your smile, your pause, your question has an impact on how that conversation is going to go, and you can connect with each other. So those are the basic primary skills that we teach in the Empathetics courses.
Reading someone's face has just made me more uncomfortable with my facial expressions than I've ever been in my life. So I don't know exactly how to do this now. Hopefully, if I get out of line, just let me know, would you please?
I will. I work with the world's most famous psychiatrist who reads my face every day on Zoom. I empathize with you.
Well played. So what would be, outside of healthcare, maybe a client or an industry where Empathetics would also bring value? I mean, it's not just healthcare
Correct.
that suffers from this. You point out the idea of people walking around on phones and not interacting. So I'm presuming there's more of a universal application potentially.
There is. During the pandemic, Dr. Reese did a lot of work with law enforcement. Of course, it was the George Floyd years. So there's law enforcement, veterinary services, any industry that touches humans. Think about the airline industry, think about hospitality, restaurants, hotels, anywhere there's a customer service element and you have people communicating with people for the sake of business, empathetics applies. So the vision is to, first of all, scale empathetics inside healthcare. Simply enough people don't know about it and get it in a model that's distributable. So we're building a platform. It will be powered by AI. It will use the data to give users through a mobile app a personalized experience to learn empathy. So think about Duolingo and that fast paced learning. It's going to be that same kind of thing that you don't have to do, but you can, and you'll earn CME and CEU when you do it. We'll continue to offer the workshops. And then we can generate a lot of content outside of healthcare for all of those other industries. That's already there. It's the core of what we do. So that's the big vision for Empathetics. Really easy to deploy, really easy to implement. It's just an app that you would download on your phone in the future. Today we come do it in person, and you do the online learning, but definitely broad application for how to connect.
You've been in the role how many months?
Been here. I just got started in March of this year.
Congratulations.
Yeah.
What are the big learnings you've had, both about Empathetics itself and the client base and how they benefit? What are the big top line learnings that you could share?
The first is most people don't realize what is empathy or the value of empathy. But empathy is one of the top buzzwords right now. If you just do an empathy search on LinkedIn, go into ChatGPT, go into Google, and you're typing in empathy, oh, that's a good buzzword. But if I ask people to define it, they have a really hard time defining what it is. So when I walk into a leadership team at a health system and I say the foundation and the root cause is low morale, toxic culture, and it's causing your people to quit your job, and I can fix that. And they say to me, how? If I say through empathy, they laugh.
Well, you've stated that it's evidence-based.
It is evidence-based.
What evidence do you have that it works?
Yeah. So Dr. Reese did her original research through Harvard and Mass General. She did 2 randomized controlled trials, specifically in 6 subspecialties at Mass General. So she has a strong body of evidence that supports the empathetics model and the empathetics content and program. And once we describe that empathy is about people connecting, people interacting, then it makes total sense.
You shared some pretty stunning statistics when we chatted earlier about success with a client.
Yeah, we have a large client on the West Coast, and they called us because they needed to improve their patient experience. The patient experience is really a lagging indicator when it comes to how your employees are doing. And if you have low patient experience scores, I encourage you to take a look at your work culture. And they called us for a patient experience challenge, and we ended up improving their turnover, their retention. We reduced turnover at this organization 17 times.
It's pretty stunning.
It was stunning, and it was a mandatory assignment. It was not volunteer. Everybody had to go through it, and we also improved their patient experience scores by 4 points. Remember, those are measured in tenths of a percent in less than 90 days.
Did the leadership begin as well? I mean,
Yeah.
you were able to get the leadership team to say,
Exactly.
count us in first. We want to
Exactly.
be
That's
the
the
example.
model. Once the leadership team goes through, especially self-empathy, realizing I needed this for myself. The other thing is seeing the team respond to the empathy training, seeing them respond to the connections, having nurses and doctors connect with each other, nurse managers and nurses who are working at the bedside, connecting with each other to say, I misunderstood you. Not you have a problem with me personally. You bring down the temperature of the work environment and you give them tools to put into place. The work culture improves overnight.
Is it fair to say that empathy is contagious?
It is.
I may not be the right way to say it, but it sounds like if I'm exhibiting empathy, that you may also
Exactly.
in return.
That's exactly right. And empathy is contagious. There are ways to disarm the person that's speaking to you. So I think about my colleagues in the emergency department all across America, and it is the toughest place, I think, to work. The patients are frustrated. They've been waiting a long time. The nurses and doctors are understaffed, and everything's an emergency. And it's an awful feeling. And when patients come in demanding, why did I wait? I need this test. I need this medication. I need this thing. Just to be able to look at them on their level, to give them a calming experience to say, I understand you need the things they're demanding. We're going to help you. Suddenly, whoa, you are? Okay. And then stating a plan for that patient. The first thing I think we need to do is get your pain under control. The second thing we need to do, and outlining that plan for them, okay, great, thanks. But then giving them the opportunity to say, if you think I'm not meeting those needs or your needs change, please let me know. Now I'm going to go get to work on the things you need. It's completely disarming. That's not the culture inside emergency departments. The culture is the guy next door is dying. I got to go. And so we teach that once you practice it and it works, you're going to keep practicing it.
You just want more of it.
Absolutely. It is contagious. And Empathetics has a lot of fans across the country. We've delivered education to over 10,000 clinicians in the US. Over 1,500 healthcare organizations have consumed our content at some point. And now we're on the precipice of growth and change. So if anybody is out there saying, that's my team, we need help, look us up at empathetics.com.
Absolutely. So what does Pam Holt do when she's not leading Empathetics?
So I'm happily married. I have 2 dogs. I have a very tight extended family. My parents and my brother and sister are just a gift to me. I love to play golf. I love to be outdoors. And I'm an avid gardener, but almost to a nerd. I save my own seeds. I cross pollinate my own seeds. So, farmer Pam in her free time.
Okay, that is nerdy. You're cross-pollinating seeds. Fortunately, though, you were at a beautiful place to play golf. You love to play. Maybe you can get 9 in after we get done.
Exactly.
Yeah.
Exactly.
So we have a habit here on Megaphone of asking a guest to take out their crystal ball, gaze into the future, tell us what your vision for Empathetics is in 3, 4, 5 years. You pick the time.
Yeah, I think in 3 years, we are delivering our content at the hands of anyone in healthcare and beyond who needs it, who wants to be better, who wants to have a lived experience. And I believe we're adding content that is supplemental to tough situations. I think about the nurse who gets in her car to drive home, and she's going to go walk through the door, and she's going to have kids to feed and a husband to smile at, and she's going to have the most amazing interaction with her family because she had amazing interactions at work all day long, and she's just going to feel connected. That's what I think Empathetics is going to be doing in 3 years.
And by the way, you all can make a ruckus. It's okay. It's live. It's not supposed to be a mausoleum here. So have fun. Thank you. You get the last word, and then we'll sign off.
I will say Medvale for me has been a growth experience. And if anyone is looking for the place to get expert advice and support from the most prestigious group of leaders in healthcare, you should check out the website. It is hard to get in, but if you can get yourself in, I encourage you to try.
It's not tough to get in the website. She meant actually Medvale. But Pam, thank you so very much. It's been a true privilege. And you are a pioneer once again, not just in your career, but here on Megaphone. This is the first live and in living color show that we've done. Thank you for being part of it. I want to thank the staff and the leadership of Canterbury Golf Club. Thank the leadership and the team from Medvale for making all this possible. And if you do get outside here, it's a gorgeous day at Canterbury Golf Club, just outside Cleveland, Ohio. This has been Megaphone from Medvale Media. I'm Dave Self. Join us again. Be well.